When using Brinzolamide-Brimonidine drops, shake the bottle well and wash your hands before applying. Avoid touching the dropper tip to prevent contamination. If you wear contact lenses, remove them before applying the drops and wait at least 15 minutes before putting them back in. To apply the drops, tilt your head back, look upward, and pull down the lower eyelid to create a small pocket. Hold the dropper directly over your eye and place one drop in the pocket. Close your eyes gently and apply pressure near the nose for 1 to 2 minutes to prevent the medication from draining out. If you need to use the medication in both eyes, repeat these steps for the other eye. Wait a few minutes for your vision to clear before driving or using machinery. Do not rinse the dropper and replace the cap after each use. If you are using other eye medications, wait at least 5 minutes before applying them. Use this medication at the same time each day to get the most benefit from it. Continue using this medication even if you feel well, as most people with glaucoma or high eye pressure do not feel sick. It's important to be aware of the possible side effects of Brinzolamide-Brimonidine drops, suspension. You may experience eye discomfort, itching, redness, discharge, temporary blurred vision, dry eyes, feeling as if something is in your eye, dry mouth, bitter/sour/unusual taste in your mouth, dizziness, drowsiness, tiredness, and headache. If any of these effects persist or worsen, it's important to notify your doctor or pharmacist. However, it's important to note that your doctor has prescribed this medication because they have determined that the benefits outweigh the potential risks. Many people using this medication do not experience serious side effects. If you do experience any serious side effects, such as fast/pounding heartbeat, eye or eyelid pain/burning/swelling, extreme sensitivity to light, vision changes, fainting, or slow/irregular heartbeat, it's crucial to inform your doctor immediately. While rare, a serious allergic reaction to this drug is possible. If you notice symptoms such as rash, itching/swelling, especially of the face/tongue/throat, severe dizziness, or difficulty breathing, seek medical help right away. It's important to remember that this is not a complete list of possible side effects, so if you notice any other effects, be sure to contact your doctor or pharmacist. As always, if you experience any concerning side effects, it's crucial to seek medical advice. In the US, you can report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can report side effects to Health Canada at 1-866-234-2345. Before using Brinzolamide-Brimonidine drops, suspension, make sure to inform your doctor or pharmacist if you have any allergies to it, to aproclonidine, or to any other substances. This medication may also contain inactive ingredients that can cause allergic reactions or other issues, so it's important to discuss this with your pharmacist. Make sure to inform your doctor or pharmacist about your medical history, especially if you have any blood vessel diseases, blood circulation disorders, depression, heart disease, kidney disease, liver disease, Raynaud's disease, or low blood pressure upon standing. This medication may cause dizziness or drowsiness, and it may temporarily blur your vision after applying it. Avoid activities that require alertness or clear vision until you can do them safely. It's important to limit alcoholic beverages and to talk to your doctor if you are using marijuana, cannabis. If you develop an eye infection or injury, or if you have eye surgery, check with your doctor about whether you should continue using your current bottle of Brinzolamide-Brimonidine. You may be advised to start using a new bottle. Before undergoing surgery, make sure to inform your doctor or dentist about all the products you are using, including prescription drugs, non-prescription drugs, and herbal products. Children may be more sensitive to the side effects of this medication, especially drowsiness. If you are pregnant, this medication should only be used when clearly needed. It's important to discuss the risks and benefits with your doctor. It is unknown if this product passes into breast milk, so consult your doctor before breastfeeding. It's important to be aware of potential drug interactions with Brinzolamide-Brimonidine drops, suspension. This can affect how your medications work and may increase your risk for serious side effects. Make sure to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share it with your doctor and pharmacist. It's crucial not to start, stop, or change the dosage of any medicines without your doctor's approval. If you are taking other products that cause drowsiness, such as alcohol, marijuana, cannabis, antihistamines, drugs for sleep or anxiety, muscle relaxants, or opioid pain relievers, be sure to inform your doctor or pharmacist. Also, check the labels on all your medicines, including allergy or cough and cold products, as they may contain ingredients that cause drowsiness. It's best to ask your pharmacist about using those products safely. If this medication is swallowed, it can be harmful. In case of an overdose with serious symptoms like passing out or difficulty breathing, it's important to seek immediate medical attention by calling 911 or contacting a poison control center. In the U.S., residents can call their local poison control center at 1-800-222-1222, while Canadian residents can call a provincial poison control center. Remember, it's important not to share this medication with others. Your doctor may also conduct lab tests to measure your eye pressure while you're using this medication. Make sure to keep all your medical and lab appointments, and consult your doctor for more details. If you forget to use a dose, take it as soon as you remember. If it's almost time for your next dose, skip the missed dose and continue with your regular schedule. Do not take a double dose to make up for the missed one. You can store Brinzolamide-Brimonidine drops, suspension at room temperature or in the refrigerator. Make sure to keep it away from children and pets. When the product is expired or no longer needed, make sure to properly discard it. You can consult your pharmacist or local waste disposal company for more information on how to do so. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.